Okay, this is chapter 2 of the fourth edition. So it's going to be workforce safety and wellness. So here are our competencies for the education standard. Knowing what workforce safety and wellness is, lift and move a patient, disease transmission and wellness principles. So we are to take care of others, but we must also take care of ourselves. We will stress that highly throughout this class. Taking care of yourself both personally, physically and mentally. This can be a high stress job at times, and it can cause many. We care for other people so much that sometimes we neglect our own selves, our families, and even our own children at times because we put this job first. And sometimes that's to be, and sometimes that's not to be. We have an understanding that we work on holidays and weekends, and we work on birthdays, and we work near natural disasters or any kind of disasters that may come our way. So we spend a lot of time away from home. First, we have to be protected from infectious disease. An infectious disease is a medical condition caused by the growth and spread of organisms within the body. A communicable disease is a disease that can be spread from person to person or from one species to another. We have many immunizations that help protect us from diseases. We have protective techniques such as hand washing, using sterile equipment, making sure we wear our PPE, and the different ways that it is made. So when these protective measures are used, the risk for the healthcare provider controlling contracting a serious disease is negligible. I am a stickler on this. Making sure your equipment is clean and disinfected is very important to help prevent the spreading of diseases. We learned a lot with COVID-19, had a lot of different ways to clean our equipment, making sure that proper equipment and proper solutions were being used to disinfect the equipment and the ambulances. We did a lot of learning throughout COVID. But prior to that, going in the back of the ambulance and, after that trauma call, having blood spread from one end to the other was, a thing that made us think that we were doing stuff. But really, at the end of the day, that blood's got to be cleaned up down in the nooks and the crannies of the back of the ambulance. That includes taking the antlers out where the stretcher mounts are and cleaning out those mounting brackets. I mean, there's a lot of different places, a lot of different things that can be touched. So making sure we properly dispose of even equipment that may be possibly infected with, anything, we have to throw that away. So you must inform other healthcare workers who you may come in contact with the patient of the potential risks. So never give sensitive patient information over the radio. Do your patient report and provide a complete history for receiving facility transfer care. COVID was another one like that. We used certain codes to say that this patient was positive so that we could be informed where to place this patient once we arrived at the hospital or the receiving facility. So that's something else to keep in mind. So there's many different routes. All contagious diseases are infectious. So a pathogen is a microorganism that's capable of causing disease in a host. The host itself is the organism or person invaded by the pathogen. So contagious or communicable diseases can be transferred from one person to another. That transmission can be direct transmission. So, that involves an organism moving from one person to another through touching without any intermediary. Bloodborne pathogens are microorganisms present in human blood that can cause diseases, such as hepatitis and HIV and AIDS. Indirect contact can involve the spread of infection between a patient with an infection to another person through inanimate objects such as needle sticks. So the object that transmits the infection is a fomite. All right, airborne. We learned this through COVID and flu and sinus infections, it seems like we are always concerned about airborne transmission. So, droplets of dust, such as coughing and sneezing. Foodborne transmission, we don't think about a lot, but it can be the contamination of food or water with an organism that can cause disease. So, proper food prep, storage, cleaning of food, preparation services, and good hand washing techniques before use minimize the possibility of illness. I know that we sometimes eat on the run and we don't have the best timing to get making sure our food is properly put away. So keeping that in mind. Vector-borne transmission involves the spread of infection by animals or insects that carry an organism from one place or person to another. So such as rabies and Lyme disease. Here's some techniques of sneezing and coughing. We learned a lot about that. Making sure that we sneeze inside of our sleeve on our shirts and different things like that. So, all right, we are all trained in handling bloodborne pathogens. Approaching patients who have infectious disease, and training is required by OSHA on a yearly basis. So you need to make sure that you have that training yearly. We figured out where that PPE was. Back in the day, I first got started in EMS. We had that little pack up there in the cabinet that we never hardly ever pulled out. But nowadays we're having to pull out more and more surgical masks, N95s, self-contained breathing apparatuses. All those were being more common. CDC developed standard precautions to prevent workers from coming in direct contact with germs. So please make sure every person is deemed to possibly be infected. A lot of times they may not tell you. So, and then making sure that you use hand hygiene, gloves, gowns, mask, eye protection. Soiled patient care equipment needs to be disposed of appropriately or cleaned appropriately. HEPA respirators, environmental control, textile laundry, needles, and other sharp objects need to go in their correct places. And that's usually a red box somewhere. Patient resuscitation, making sure that we wear the proper PPE with these patients, and respiratory hygiene and cough fatigue. Notify your designated officer if you are exposed, and that way that you properly follow your policies and procedures. And please make sure that you know your policies and procedures. If you don't, you need to become very familiar with them, because if you don't follow them to the T, you can set yourself up for a lot of trouble. All right, the most effective way to control disease transmission is to wash your hands. Hand sanitizer is great, kind of in between, but washing them with soap and water is the most effective way. Gloves need to be worn on the back of the ambulance. We get kind of lazy sometimes, and we start just cleaning stuff with these hand sanitizer wipes. I was a big component of, we come in on a rotation, the ambulance got cleaned head to toe, all the, most of the equipment, most of the common places where somebody could touch, and it's not that I didn't trust my crew before, but you never know, if they cleaned it properly, did they clean it all the way? And this includes the front of the ambulance too. The steering wheel, the dashboard, the radio controls, the radio itself, and the mic. You need to make sure that you cleaning all that area too. Your clipboard, the pens you use. So there's a lot of different things to be cleaned. Text from the blood, air protection protects. Goggles are the best eye protection from blood and fluid splatters. Prescription eyeglasses are not adequate because they don't have the side protection. So face shields also protect if you have those available. Gowns, we started wearing gowns a whole lot more, especially with blood splatter and the cough. So make sure you're familiar with those. Field delivery and infant or major trauma, and where they're at on the back of your ambulance. Mask respirators are a barrier device. Use certain standard surgical masks if fluid splatter is possible. Place the mask on the patient with a communicable disease, and then use the mask on the patient and HEPA respirator for yourself if TB, influenza, or COVID-19 suspected. I was amazed at the amount of people that were diagnosed with COVID-19, they'd be at home, they wouldn't be wearing the respirators and the surgical masks, but everybody else would be wearing one. And so I had a patient contact. The patient that was diagnosed with COVID-19 came walking out the house without a mask on. That was our first question: is where is your mask? So make sure these are being placed on appropriately. Mass respiration, mouth to mouth to mouth resuscitation may transmit diseases. So this is why we don't recommend mouth to mouth. We give respiration. So having a barrier device is most appropriately, even if it's just a face shield, but making sure that you decontaminate those afterwards also is very important. Don't recap, break, or bend needles on disposable sharp objects in approved closed punch-proof containers. And you should have one readily available to you, whether it be on the back of the ambulance, in a jump bag, or somewhere. Please don't overfill these either. Once that cap gets locked, and making sure that you have needles inside of those devices too. I see a lot of blood soap, alcohol pads, 2x2s, and different things like that. There's a place for those, and that's called a trash can, and those should be labeled in red. Also, if you've got blood soaked stuff in there too, so there's a proper place for everything. All right, your employer cannot guarantee a 100% risk-free environment, so there is a risk of exposure to a communicable disease as part of an AEMT's job. Your job is for infection. It's not high, so your risk for infection is not high. Your employer should follow OSHA guidelines and regulations, and some follow the NFPA, the National Fire Protection Association. So know and use your department's infection control plan. Please know this, your department's infection control plan. They're usually pretty standard. And the biggest thing is to make sure that you tell your next in line command what's going on if you are exposed, so that proper treatment can begin and the paperwork can start going downhill. All right, clean the ambulance after each run on a daily basis. Like I said, I was a big component of this. Everything got cleaned back there. We spray Lysol spray back there. I mean, there's just all kinds of different stuff that can be used. So make sure you know how to use that and help. So there's other things such as the Hep B vaccine or hepatitis B vaccine program, and making sure that you're up to date on that vaccination. So make sure you discard all equipment appropriately. It's like he's putting this blood soaked towel inside of a rig biohazard bag and not in the discharge container. So, all right, immunity. Even if germs reach you, you are not necessarily at risk for infection. So it is a major factor in determining which host will become ill from which germs. So immunity can be gained by having been immunized or vaccinated and recovering from an infection from that germ. So some immunity is only partial, so it protects against new infections, but germs that remain in the body from the first illness may still be able to cause the same disease again when the body is stressed. So humans cannot develop immunity to some diseases such as HIV. So germs that cause no symptoms in one person may cause serious illness in another one. So once again, some education we learned from COVID. Some people were fine with COVID, and they could get over it quickly, and some people, unfortunately passed away from COVID. So just something to think about. Your body does react differently, and with age too. All right, maintain your personal health. Get your immunizations if they're available, and when they are, get a TB test yearly, and that should be put on file for you yearly. So, and follow your standard cautions. So making sure that you wear your gloves, making sure that you're wearing proper PPE. We one time it was policy where I was working that you have a surgical mask on with all patient encounters. and we had a group of people that were spotted with cell phones, and there were some problems there, for those employees. So please be mindful of that when you're out and about in public. So chickenpox vaccines, should be given Hep B vaccine on as required. Flu vaccine and COVID stuff now, pneumonia vaccines are available yearly. So, all right, if you're exposed to a patient's blood by fluorist or the over patient care to another EMS provider, if available, when safe to do so, clean the exposed area, rinse your eyes if necessary, and activate your department's infectious control plan. So you should clean the area with soap and water, not just the hand sanitizer. Um, if your eyes are exposed, you should be rinsing out for about 20 minutes. Activate your department control plan, whether that be telling the supervisor going to appropriate facilities for care. So time is important. So some diseases will act quickly and others will lay down dormant. So early activation of the plan is the best policy. You may not even realize that you have been exposed to the disease until a hospital notifies you. So, we take patients in, we don't know exactly what's going on with them. We think they may have X, Y, and Z, and they may not have that at all, and they've got something else. So, you being able to document your wearing your full PPE is a necessity. So, please make sure that if you are wearing that stuff, you are documenting it, because if you do get exposed and you don't have it documented, then that's a case against you possibly. All right, post-exposure care prophylaxis may be indicated, so that may be the last defense for AEMT who has a significant exposure. It is not available for all diseases and offered only if an investigation determines you had a significant exposure. We can be involved in prevention, so EMS providers will consider a high-profile role model. So, the top 10 causes of death in 2017 are listed here. So, making sure that we're keeping ourselves yearly checked, we're keeping our heart up to par. We don't have the best eating habits in the world because of our way of work. 12-hour shifts on the go all the time. We seem like we're starving down food as quick as possible, and we'll probably eat from McDonald's 90% of the time. So, and that leads to all this stuff here. And suicide there at the very bottom, I see that in the near future going up for EMS providers because of the mental health that we have to go through also. So just be mindful of that. Be mindful of the people you work with. If you do see something, make sure you can assist them and possibly getting help. Please make sure that you're wearing your seatbelts and shoulder harnesses. Your equipment should be restrained in the back of your ambulance properly, whether that be on a mount or seatbelts onto the stretcher itself, and follow your protocol as far as donning your PPE. Make sure that your scene is well marked and well lit. We've had a couple cases I know of where people are, unfortunately, get hit while on the scene, especially traffic accidents. But that could be at a residential place also, because people do not pay attention like they used to in the past. So place warning devices, mark a safe, convenient distance, and check your vehicle stability. Please, don't get in a hurry trying to jump off the back of the ambulance and get yourself hurt. A couple cases on that too. People just in a hurry. Equipment not being placed properly back where it's supposed to, laying on the ground next to the apparatus, and it's a trip hazard. So walking around on scene and there's oil and gas everywhere, and we get on that boot, and then we get on a cleaner surface and we slip and fall. I've had a couple of accidents myself, getting in a hurry, coming downstairs and fell and twisted my ankle all to pieces. And so we have to be mindful of what we're doing. Our adrenaline gets ramped up, and then we get in a rush and we injure ourselves at times. All right, don't forget about your DOT emergency response book. There's an app for that too. So if you have that available too, you know, that may be something to use. So make sure the scene is safe for you and your partner. If it's not safe, you know, you have to take precautions on approaching that scene. You don't have to get there. Um, make sure that you get there to provide care is the most important thing. If while you're there, I've always told and trained the people I know one way in and about 3 or 4 ways out if needed. Um, and if this thing does turn sour, at least you can get out of there if needed. All right, vehicle crashes are, you know, lethal situations. I talked about some of those 2 slides ago, but please make sure you wear your protective gear if you're being issued helmets and goggles and gloves and fire retardant gear. If you have that available to you, please make sure that you put it on, even if it's 110 degrees outside. If you don't have on that protective gear that's been issued to you, a lot of EMS services are getting bulletproof vests also. So you can make sure you know when to wear that stuff and when not to wear it. All right, down power lines. We don't train on electricity. We don't handle electricity. As far as power lines are concerned, I'm used to the theory that everything's hot until I've been told completely different. So mark it off them and do not approach down wires. Lightning is a direct hit of ground current, so stay away from drained ditches, moist areas, salt, small depressions, and wet roads. So move to the lowest area possible and avoid projections. All right, fire, we are not trained. We have to differentiate ourselves sometimes from, you know, firefighting and EMS. You know, we're there for the firefighters at times. So make sure that, you know, we know that that smoke is toxic. It's oxygen deficient. And an explosion can happen at any time and building collapses. So we don't want to put ourselves in those harm ways. So be trained in the use of airway protection to have it available if you do. All right, mass balance has become more of a thing with civil disturbances that we see, unfortunately, on a daily basis. So we have people protesting and riots and causing damage to property that shouldn't be. So be mindful of that. What proper where you should be staging at. We are not law enforcement. If you cross train, make sure that you know your um, limitations and liabilities on both sides of that fence. Domestic disputes can go sour really fast. So making sure that we, you know, have a way out of those and crime scenes. Those are very important when we're approaching them, making sure that we won't in a particular area designated by law enforcement and we keep that area as clean as possible. So, all right, when several agency responds, knows who's in command, who's taking, you know, EMS command, who's got command over the whole scene as a whole. So, and try not to disturb crime scene evidence unless absolutely necessary. All right, behavior emergencies can be very tense at times. So, you know, there's not really a physical cause, it's more psychological causes at times. So these can turn very violent and pose a threat to you as a provider very quickly. So don't go in a room one-on-one with these patients, close the door, make sure that you know your way out of that house. Some self-defense techniques may be, you know, proper also so that, you know, if you do need to defend yourself, you're trained in that properly. There's a lot of classes out there for that too. So make sure you do a full physical assessment of these patients though. There could be, you know, some underlying causes that's causing this patient to act like it's a behavior emergency. All right. Protective clothing. So wearing protective clothing and other appropriate gear is crucial in your personal safety. So be familiar in your protective clothing, making sure that you understand what you're are supposed to be wearing versus what you're not supposed to be wearing certain things. So I've talked about that. Um, Sunblock is, using that SPF. It's going to be on the scene for a very long time. Make sure it's readily available to you. Your hats, just the ball cap at times. Sunglasses, for those that have maybe sensitivity to that light also. So stress, it is a high stress job. We have a lot of different patient encounters. Um, Seems like call volumes everywhere are going up and up and more uh, on a yearly basis. So make sure you know how to deal with your stress personally, professionally. If you need help, there's plenty of agencies out there. You do not have to let your employer know unless it becomes effective to your job, and then they might can provide some suggestions to you. So we need to take care of ourselves. If we get tense, muscle tension, angry, 99% of the time, blood pressure goes up, turning face red in the face all the time, heart rate stays up. So this is all signs of stress, and stress can induce other things. So we need to be mindful for our own personal selves. So acute stress reactions, characterized by feeling nervous or excited with increased ability to focus. Delayed stress reactions manifest after a stressful event. So the AEMT is able to focus and function during the crisis, but left with nervous, excited energy that continues to build afterwards. So learn stress management techniques and take effective manage delayed stress. Cumulative stress reactions are those that result in prolonged or excessive stress. So we're unable to shake off events. Each time an event occurs, the AEMT finds it harder to recover and becomes more exhausted. And a contributor to heart disease, hypertension, cancer, alcoholism, and depression itself. So make sure that you know how to handle your stress in the long term. PTSD is a real thing. We remember these certain calls for years and years and years. Mine's pediatric related calls. Um, so I remember all those. Sometimes we let our head down and we still think about those. So make sure that you know how to handle all this stuff. All right. Acute stressors are sudden, severe, and usually stressful emotions, MCIs. A lot of stress in a short period of time. And sometimes the MCIs elongate out, to days and days and days. So serious injury with traumatic deaths of children, crash with injuries caused by emergency services providers, and so death or serious injury of a coworker may also cause us some acute stress reactions. PTSD, I've talked about that. So depression, startle reactions, dissociative episodes, uh, dependence on substances, certain substances. So, make sure that we know how to take care of all this stuff for ourselves. So irritability, inability to concentrate, difficulty sleeping, increase in sleeping, and nightmares. So sadness, anxiety, guilt, or hopelessness. So loss of appetite, isolation from everyone. So sometimes we just need to take a vacation. And that was kind of hard to do at times because it seems like we're so short staffed at times. So talk about it. Find you somebody that you can release all this to. So that if you don't have anybody, please make sure you can find help. So take your days off. Take your days off seriously. If that includes exercising, different things like that, that's one of my stress reliefs. I can go to the gym or lift everything, and it kind of chills me out. Going into work, we most of us work shift work, and then we got 2 or 3 other jobs. Sometimes we have to make sure those other jobs are something totally different from EMS. so that we do get a psychological break from the day-to-day occurrences that we go through. All right, citizens are available. Your agency should know how to get in touch with people to make these critical incident stress management debriefings happen. So they can be formal or informal. They can go, on days after the incident, or they can be immediately after the incident. So, just making sure that we understand what they're there for, and how they are set up so that, the proper people come in and are able to present these effectively. All right, we don't want to be burned out. Chronic fatigue and irritability, lack of desire to report to work. I'm feeling being overwhelmed, overeating, smoking, or abusing alcohol or drugs are all signs of burnout. Like I said, if you have other jobs, please try to make sure that there's something other than related to EMS. But sometimes that's the easiest way for us to pick up is another job with EMS or overtime at our local agency. But time after time, this can lead to burnout itself. So take care of your own health, learn how to relax, do not make unreasonable demands, and debrief after tough calls if needed. All right, compassion fatigue is gradually lessening of compassion over time. So symptoms include high absenteeism, difficult relationship with coworkers, aggressive behavior towards patients, strong negative attitudes towards work. So, when we get in the job, we have compassion for everyone. It seems like over time, unless it's, absolutely being sawed off or you're just not bleeding profusely, we don't really worry about it. So, that's something that, maybe a sign to us that we need to take a step back and find a way to deal with this in another route. All right. Recognize you and your colleagues are becoming more overwhelmed. Emergency workers are at higher risk for suicidal thoughts and attempts than non-emergency workers. So understanding the select strategies to deal with stress in a constructive manner. So if you do encounter any suicidal ideations or colleagues expressing such ideations, seek help, which is to include professional counseling. So peer support is a process by which a properly trained member of your department provides confidential support to another member. So there's many peer support programs out there. There's hotlines for this. So make sure you understand how to get in touch with these people. It's the most effective way if you need it. Wellness and nutrition. We like I said before, we eat fast food all the time. So if you have the ability to bring well cooked food to work, that is great. Sugary drinks, we have to stay hydrated while we're on the road. But staying hydrated, doesn't include those monsters and bulls. They're monsters and things, and those high caffeine drinks. So please make sure that you understand how to eat and what to eat and when to eat it. All right, exercise relaxations, practice relaxation techniques. Try to exercise on a daily basis. Getting 30 minutes in of walking or running or just moving around at least 5 times per week is a great way to lower your stress also. But so in our job line, we do it's a high physically demanding job. We have to lift up patients all the time. We have to move them side to side. So it keeps us physically ready to perform our job duties every day also. All right. Make sure you get regular sleep uninterrupted. I know night shift, it seemed like it was hard. People get up during the day, your next door neighbors, they're out there mowing the grass or they're doing work and you're hearing it, while you're in there trying to sleep yourself. So trying to find somewhere to get properly sleep is very important. So Know your family's health history and adjust your lifestyle if necessary. So balancing work, family, and health. So somehow find a balance, with all that. And we had seem to do have a lot of divorces within our organizations, um, or our line of work, and that's just a lot of times we spend more time at work than we spend at home. So if you're having trouble at home, make sure that you're can find yourself, some assistance if needed, and just take the time to take time off when it's possible. So, all right, we don't want to be engaged in substance abuse, alcohol abuse. Seems to be the most popular way. Please remember that you could be possibly drug tested at any time. So if you do have a problem, you need to notify your employer. Maybe they can provide some help. And if you are on prescription drugs that may come up on a drug test, you probably want to let your employer know that also. All right, workplace issues. Everyone's different. Um, we all communicate differently, so we need to be respectful of that also. Learn how to relate very effectively with other cultures, and so recognize that there are legitimate differences in various cultures in response to stress. Sexual harassment does not need to be in the workplace. You do have the quid pro quo or hostile work environment. If someone does feel uncomfortable in the workplace, so make sure that you know what to say, when to say, and how to say it. All right, death and dying can be something that we have to deal with. It may be sudden or it may be after a prolonged terminal illness. So these stages of grieving are there. The hardest thing about death and dying is sometimes trying to figure out where the family or friends are at in the stages of grieving. Because you go in there and you say, well, unfortunately, everything that could be done and has been done for this patient, and they have passed away, and you don't know where they're going to be. So they can become angry and hostile really quickly. They could bargain with you and want you to do more, even though you know that there's nothing else that can be done. Um, or they could be already in that depression, and they've accepted that the death is there and it happened, and they're able to deal with it. So make sure you're working with the family members, making sure that you understand what they need and possibly what they don't need. Sometimes we get called out for things that we shouldn't be there for, but the family, it's that instantaneous reaction to call for help. When in all reality, there may be a hospital patient already, and the family's been taught to and educated. It's just that sudden reaction when death has occurred. So try to remain professional um, as much as possible. Okay. Um, if you do have a patient that is dying in front of you, please keep them as comfortable as possible. Talk to them, see where they're at, see if there's any questions they may have. I know that we don't really know what happens at the death. Um, some people think that they're dying and possibly are not. Um, so learn how to deal with each one of those. Children are tough. We have to deal with that. Child death is traumatic to everyone involved, the family for sure, and friends, the other people that were involved in the accident probably. So it does hit a whole nother threshold. Us being able to um, help people through that is going to be very important. All right, let patients know who you are, especially if they're clinically ill and injured. What you're fixing to do, how it's going to happen. You know, a lot of I've had patients ask me, are they going to fix them to die from this injury? I often tell them, with us, hopefully not. I'm going to do everything that I can to keep them alive. So just making sure that you understand their needs and their questions too, and appropriately tell them what's going on. So please, be honest with these patients, because we don't know if they may pass away in front of us in an instance. We don't know about the internal injuries that they have. So, but also respect religious customs and patients' needs, especially at those homes when certain things are supposed to happen before they are removed from the house. Respect that also. All right, deal with possible initial refusal of care, allow for hope, locate, notify family members. And I think it's very important. If you have stopped resuscitative efforts, wherever you're at, you need to let the family know. Okay, that we've done everything we can. Um, usually what we do in the field is about the exact same thing that may happen inside the hospital in the emergency room. But we need to be honest with them and let them know that there's nothing more that can be done. All right. It's untrue. If it's unclear if a true medical emergency exists, so contact medical control about need to transport, and then you may have to go through a legal process. Um, so if in doubt, try to acquire the patient's consent to transport to cover everyone. All right, that's the end of chapter 2.